طلبة كلية طب الأسنان جامعة ميسان، أهلا وسهلا بكم بالمحاضرة الأخرى بموضوع البيدياتريك دنتستري. راح نتكلم عن pulp therapy in the pediatric dentistry. Introduction about this subject. Despite the modern advances in the prevention of the dental caries and an increased understanding of importance of maintaining the natural dentition, maybe teeth are still lost prematurely. Therefore, the primary objective of the pulp treatment of an affected tooth is to maintain the integrity and the health of the oral tissue. Therefore, the integrity of the oral tissue and the teeth in the milk dentition and the primary dentition is very important in order to restore oral health. Therefore, additional reason to preserve the integrity of the primary dentition are: number one, reduce the likelihoods of the mesial drifting and the resultant malocclusion. Aids in the mastication, preserve a pulpally involved primary tooth in the absence of the succedaneous tooth، يعني الأسنان المعوضة. إذن احنا راح نحافظ على كسبيس مينتينر الديسيديوس توث إلى أن السكسيتينيوس تيث الأسنان الدائمية تبدي تظهر. Prevent possible speech problem. Maintain the aesthetic. Prevent apparent tongue habit. Any bad habit must be prevented due to the loss of these primary teeth. Maintain normal eruption time of the succedaneous teeth. Sequela of eruption of the permanent teeth become regular if the deciduous teeth shedding regularly. Prevent the psychological effect association with the early tooth loss. المساوئ النفسية على الطفل، المساوئ الإشكال قد تسبب له عقدة نفسية نتيجة فقدان هذه الأسنان اللبنية في وقت مبكر. Therefore, the pulp therapy maintain this and preserve this type of the teeth and maintain the good oral health of the tissue. Major function of the pulp. Here we can put a scope on the function of the pulp. As a review, the pulp performs 5 major functions. The first one, induction. Pulp participates in the induction and the development of odontoblast and dentine, which when formed induce enamel formation. Number 2, formation. Odontoblast form dentine. Dentine is formed continuously throughout the life of the tooth. هنا نخلي خطين تحت هذه العبارة. Dentine is formed continuously through the life of the tooth. عكس باقي الأنسجة مثل اللي لها limitation أو لها وقت محدد. Odontoblast can be also form a unique type of dentine in response to the injury. إذن secondary dentine, reparative dentine, tertiary dentine, this is the unique type of the dentine in response to the injury, such as occur with caries, trauma, and restorative procedure. The third function of the pulp, nutrition via dental tubules. Pulp supply nutrients that are essential for the dentine formation and hydration. Number 4, defense. Odontoblast form dentin in response to the injury, particularly when the original dentin thickness has been compromised by caries, wear, trauma, or restorative procedure. Pulp also has the ability to elicit an inflammatory and immunologic response in attempt to neutralize or eliminate invasion of the dentin by caries causing microorganisms and their byproducts. And the last one, sensation, function of the pulp by sensation through the nervous system. Pulp transmits sensation mediated through enamel or dentin to a high nerve center. Diagnosis of the pulp. Diagnosis of the pulp pathology. How you can diagnose of the pulp pathology by different procedure and different way. The first important we must diagnose is the pain. An accurate history must be taken and the type of the pain, frequency, location, separate, aggregating, and relieving favor. Therefore, mode is the onset spontaneous or provoked. Periodicity. The periodicity, do symptoms have a temporal pattern, or are they sporadic or occasional? Early pulpitis, symptoms seen in evening or after meal, يعني خلال المساء أو بعد وجبة الأكل. Frequency of the pain. Have the symptom persisted since they began, and have they been intermittent, وبعدها تكون متقطعة أو متوالية بتقطع. Duration of the duration of the pain. How long do symptoms last when they occur? الفترة التي يحدث بها البين من بدايته إلى أن ينتهي. Quality of the pain. dull pain, خفيف. itching pain, ألم قوي أو حاد. and pain of the pain of bony origin. Throbbing, bounding, pulsing pain of the vascular origin. Sharp, recurrent, stabbing, pathosis of the nerve root complex, irreversible pulpitis. Postural changes of the pain. Pain accentuated by bending over. Time of the day. Pain in the masticatory muscle on working may indicate occlusal disharmony of TMJ and dysfunction, or possible acute pulpagia. Hormonal menstrual tooth ache due to increase in the body fluid retention. Teeth may be ache and may become tender on percussion. Symptoms disappear when cycle ends. Now we talk about types of the pain. We have different type of the pain. The first one, momentary pain, immediate stresses to hot or cold that disappear on the removal of the stimulus indicate that the bathosis is limited to the coronal pulp, يعني not extend to the radicular منطقة الروت. Persistence pain from the thermal stimuli would indicate a widespread inflammation of the pulp extending into radicular filaments. Spontaneous pain, another type, spontaneous pain, throbbing, constant pain that may keep the patient awake at the night, يخلي البيشنت يستيقظ أثناء الليل. And this type of the pain indicate pulpal damage, irreversible pulpitis. It is suggested that the pulpal disease has progressed too far and a treatment confined to the pulp chamber would be inadequate. Provoked pain, another type of the pain, provoked pain, stimulated by thermal, chemical, or mechanical irritant, and it is eliminated when stimulus is removed. This sign indicates dentine sensitivity due to the deep carious lesion or due to the faulty restoration، يعني حشوة خاطئة أو بها علو أو بها ارتفاع. The pulp is in the transition state and the condition is usually reversible. Now, number 2, after the pain assessment and the knowledge about the type of the pain, we must estimate or assess the visual and tactile examination. This is one of the simplest tests, but most often is done casually during examination, and as a result of valid information is lost. A thorough visual tactile examination of the hard and soft tissue relies on the checking, and that is color, contour, and consistency. Three C's that mean color, contour, consistency. This can be assessed as a visual and tactile examination. Number 3, assessment of mobility. Mobility must be assessed to the deciduous teeth during examination. Mobility in the primary tooth may result from the physiological and pathological cause. Tooth mobility is directly proportional to the integrity of the attachment apparatus. من هو الاتاتشمنت apparatus؟ الاتاتشمنت اللي هو البريودنشيوم. اذا هو الموبيليتي هي proportion، تناسب طرديا ويا الحالة الصحية للبريودنشيوم او الاتاتشمنت apparatus. A clinician should use 2 mouth mirror handles. يعني الدنتيست يستخدم الهاندل مال dental mirror 2 to apply alternating lateral force، ويسلط lateral forces in the facial lingual direction to observe the degree of mobility of the tooth. A measure of the mobility is يكون measuring of mobility according to the index below, and this is index consists of 0, that's mean horizontal mobility less than 0.2 millimeters. 1, horizontal mobility of the primary tooth equal to 0.2 to 1 millimeter. Number 2, horizontal mobility of a primary tooth from 1 millimeter to 2 millimeter. Number 3, in the progression of the mobility, increase the progress of the mobility. Grade 3, horizontal and vertical more than 2 millimeter. Assessment of percussion. Pain from the pressure on the tooth indicate that the periodontal ligament is inflamed and tender under percussion, and this a usual clinical test. To apply finger pressure to the tooth and check the child response by watching the eye. يعني احنا من خلال pressure of the finger راح نشوف انه الريسبونس of the child راح يبدي يحرك عين نتيجة الريسبونس او البين اللي راح يحدث. Palpations. Simple tests done with the fingertips using light pressure to examine tissue consistency and pain response. It is determines presence, intensity and location, يعني شدة وموقع ووجود الألم, and the presence of the bony cryptus, the bony cryptus in this area. Also, assessment of the restorability of the tooth, primary tooth. Only a tooth which can be restored after endodontic therapy should be considered for part therapy, وإلا يكون إذا يكون useless أو progress poor prognosis, tooth اللي poor prognosis not restorable must be leave. Number 7, assessment of the presence of the discharging sinus indicate a non-vital pulp or an irreversible disease pulp and should be considered for non-vital pulp therapy. Changes in the color. Discolored teeth may be indicate a necrotic pulp. The discoloration that the pulp necrotic or degeneration of the pulp. Recent preoperative radiograph are requested to the pulp therapy in the primary and in the young permanent teeth. يعني شنو اليونج permanent teeth؟ معناتها permanent teeth erupted by the root is not fully completed formation. Apical forum not formed yet. It demonstrates the pathological condition, position of the succedaneous permanent tooth. This will indicate that the decision on the performing pulp therapy for primary tooth. One factor that must be remembered that the lesion must be of the sufficient dimension to appear radiographically and must be involve cortical bone. Radiographic assessment is a very important and prerequisite before starting of a treatment due to the many things. One factor that must be remembered that the lesion must be of the sufficient dimension to appear radiographically and must be involve cortical bone. يعني لازم يواصل إلى الcortical bone. Pathological entities that observe A. pulp calcification, أنه راح نشوف الأمور المهمة من خلال الإكس راي اللي هي البulp calcification. Represent the pulp response to the long standing lesion. يعني calcification معناتها البulb responds to the long stand lesion and it is associated with the pulp degeneration. This contraindicated single visit pulpotomy يعني وما نقدر أنه نسوي single visit pulpotomy. B. Internal resorption. It is associated with the spontaneous pain at the night and inflammation extending into radicular pulp يعني إلى منطقة الروت, and this contraindicated single visit pulpotomy. C. External resorption can be seen. Pathological resorption is invariably associated with the no vital bulb and extending inflammation in the supporting tissues. The only viable treatment is pulpectomy or extraction. Pulpectomy or extraction, that means أنه lesion extend into the radicular area. D. Bone resorption. If minimum bone resorption, pulpectomy is the choice, but when the bone loss is extensive, extraction is indicated. إذن البون ريزوربشن يعتمد حسب الكوانتيتي، إذا الكوانتيتي مالته less or more, pulpectomy or extraction. Current radiograph are essential to examining for caries and periapical changes. Interpretation of radiograph is complicated in the children by physiological root resorption of primary teeth, milk teeth, and by incompletely formed root of the permanent teeth. The radiograph does not always demonstrate periapical bathosis. هاي مهمة جدا، خلي جواها نقطتين أو خطين. The radiograph does not always demonstrate periapical bathosis, nor can be proximity of the caries to the pulp always be accurately determined. What may appear as intact barrier of secondary dentine overlying the pulp may always be perforated a mass of irregular calcified and carious dentine overlying the pulp with the extensive inflammation. The presence of the calcified masses with the pulp is important to making a diagnosis of the pulpal status. Pathologic changes in the periapical tissue surrounding a primary molar are most often apparent in the bifurcation or trifurcation يعني منطقة الراديكولا منطقة الروت area rather than at the apex such as in the permanent teeth. إذن بالبرايمري هاي الليجن يكون دائما نشوفه قريب على البايفركيشن أو ترايفركيشن، مو مثل البيرمننت اللي يكون قريب على البريابيكال angle. Several additional factors worthy of consideration are as the follow. Number 1, A. More than one view of the area of interest, each taken at a different angle, يعني tube shifting technique, Clark technique, is helpful for location subtle changes. Example, root fractures. B. Pathological changes should be confused with the normal anatomy. Example: mandibular canal, mental foramen, incisive foramen, nasopalatine canal. كل هاي لازم احنا نميزها عن الليجن اللي تعتبر normal anatomical landmark. C. Internal resorption is a possible in the permanent teeth but does not occur as often in the primary teeth. الانترنال resorption يكون هو بالpermanent but does not occur often in the primary teeth. D. Treatment induce calcified. Example: bridging or apical closure may be too thin to visualize in radiogram. تكون thin بالنسبة للprimary tooth. Therefore we can stop to this point 10. In the next lecture we will complete the information. Thank you very much due to the listening to the part 1 of the lecture, and see you.